Okay, here's the boxing or unboxing of the Kitaro kit. You can see that there are two different types. The first is this dry lab, wet lab, and the second is the complex lab. This is obviously this one right here. And it shows you right here, what does it mean by dry lab, wet lab? Dry lab is going to be the part that you can do without the phaco machine. And then the wet lab is going to be with the machine and all the fluidics. So we're going to go ahead and open this now. Ooh. Okay, so you can see here inside the top, here are the instructions. That's nice. Things to prepare, settings for the machine, how you put together, and then some instructions how to store unused lenses. We have also here DVD. Oh, a nice picture of what the system should look like. So the entire system's in here. Here is some other instructions. Here we go. Some basic information. Okay, so here are another set of instructions, starter kit. So similar information here. And then I guess this is a list of all the elements that are inside the kit. So let's take a look. Here we go. So here's some tubing. We can see here, this is the irrigation bag that we're going to use. This is the face plate. And under the face plate here is going to be the two, so there's an elevated orbit and a lower orbit. Here's the magnet that basically holds this shell in place. Here we go. So that's the face. And on the other side, we can see here, we have some of the anterior capsule film. And then we're looking at some syringes. So this is the hydrodissection needle. So it's a syringe and needle. We have here cystotome needle. This is a 26 gauge and 21 gauge cystotome. That's pretty big needle. Okay, some capsular film that already has the capsulorhexis made. This is the clay that you're going to put inside the shell in order to have some foundation in order to do the capsulorhexis. Some fake viscoelastic substance. This is, very nice, some scleral corneal sheets. So this is this at the limbus here. And then these are really important. This is the cornea iris that you're going to make your incisions and then enter in order to access with the phaco. And then here we have, these are the nuclei, so made out of clay. And then these are plastic pieces that are already pre-chopped and segmented, so you can practice maneuvering your instruments inside the eye. And then this here are some instruments, so mock instruments, and more and more mock instruments here. So obviously those can't be sterilized. Okay, let me take this out. And then inside here, I guess this is just the folder. Here's your drain box. Very nice. And oh, I guess that's just the inside plastic. And this is the drain box. That's very nice because obviously you'll get wet. And then this must be what connects to the tubing. Okay. All right. Let's take this to the lab and see what we can see. So here is the base. So here's the lower orbit. Here's the upper orbit. We'll do it here. And then I have the corneal scleral shell, and it's connected by a magnet on there. I'm going to go ahead and I'm going to put this base that's already in there with the capsule on top. And then let's put this shell on top right here. Oops. It's not squeezing on. Am I doing the right thing? And I'm going to put a little bit of viscoelastic on top, just a little bit. In here. So we're going to start here by using our cystotome and going through the scleral wound and just puncturing in the center and pulling to the side and creating a flap and letting that flap turn over so we can look at the underside. And then we're going to switch now to the second instrument, which would be the Utrata forceps. And just grabbing right next to that edge, the leading edge, which is flapped over, in order to gain the most control, and turning in the wound in order to get that to come around, and re-grasping carefully again near that edge, the leading edge, and to remember to pull in a tangential motion to the circle that we're trying to create. And then again, re-grasping, letting the flap come all the way over, and then bring it around to its completion. There's a center little area there that's stuck. We're just going to take that out. I'm going to show you the setup again in order to practice your capsulorhexis. So you have your scleral shell. We're going to put our mock cortex inside this little thing here. You have extra here, so again, you don't want to throw that away. This is also, apparently this, you can massage it to soften it, and then this one will never dry out. So we're going to just keep those covered for now. Okay, we're going to go ahead and put our capsule on top, so part of your roll, and then we're going to cover it with this. And then we're going to proceed just as you saw, and that is to make the capsulorhexis opening through here. And then after you finish making one opening, you're just going to go ahead and move this to the next section right here and go ahead and practice again. And so you can see that with one small piece, you can practice many, many times and do many capsulorhexi. To practice nucleus manipulation and getting comfortable and familiar with these tools, you're going to use the shell again, and then we're going to take these items here, and these are the segmented plastic nuclei. So we're going to take one of these, so these are not disposable, and we're going to go ahead and place it inside. Oops, I think we need a... Okay, we're going to take our orange shell, we're going to put this inside, and then we're going to take one of the pre-cut capsulorhexi from here. So this is a capsulorhexis that is the appropriate size, and we're going to center it here, and then go ahead and place again this very important shell on top. So here it is right here. Okay, so now you can see here, you can use this to then practice manipulating your instruments. And so that is now taking your mock instruments here and then going through one of the wounds and then practice how will you crack the nucleus, how will you spin. And so it just gives you some idea. So for example, you want to be in the periphery here. You want to avoid touching the edge of the rhexis here. And then it gets you familiar with, for example, here is the actual a phaco tip. So this would be the size of the phaco tip. And are you able to put that in and, go ahead and feel how it grooves appropriately and things like this. And then you can put a second instrument the other side and crack this apart. So that's what this is for. The next step will be to take this actual clay nucleus that's not pre-divided and do the same thing and put it inside, put this pre-cut rhexis on top. It's not well centered. But you can then practice things like grooving like this and getting a feel for what that feels like to get into the material, and then to take a second instrument like a chopper and what that feels like to go inside and maybe try to crack that apart. Or maybe to get under the rexus here and pre-chop, something like that. So that's what this part of the kit is for. And afterwards, you can take this off, remove this, and then remember, this is not to be thrown away. So you're gonna go ahead and just soften it, put it back together again, keep that in here, and then put that back in for storage. The next set here is for the purpose of practicing creating the wound. So we're gonna open this up here. This is the limbus, and we're gonna actually put one of these little stickers on here. Let's see here. Okay, so you can see here, we're gonna put it, let's maybe right here. So, and I guess you could practice, you could put this back on here. I don't think you need it. Snap that back on, okay. And so this is where you're gonna create your wound. Oh, I guess we should put our face on. Okay. And the reason why I say that is you have to figure out where you're going to, sort of balance yourself here. And so you can see here, maybe I'll make a real temporal wound here. And so this will just allow me to just get in here. So it's practicing the manipulation of my keratome blade here. And I'm gonna go ahead and enter. Okay, and so that's my biplanar wound, which clearly didn't go so well. Let's try one more time. So it's engaging here. Yeah, so practice making wounds through this material here. This part is disposable, and you obviously keep this and put that back. So the last part of this lab is the wet lab portion, and that is the use of these artificial nuclei. They come in different densities. So you can see here, medium and soft. And these are one-time use only, because obviously you're going to go ahead and phacoemulsify. So these have to be refrigerated. You take them out, let them, I guess, come to room temperature before you use them. So again, this comes in this little holder. We're gonna put that in here, and then this is the cornea that you're gonna make your wound in. And these you can use about 3 times before you dispose of them. And you can see here, there are marks here, so you can figure out, you can make sure you know where your wounds are. So if you go ahead and put this together like this, you're gonna go ahead and proceed with your phaco, make a wound, do the capsulorhexis. You're gonna phaco out that central material here, and then you can swap it out. So once you're finished with this, you're gonna take this out, put a new one in, and then you can just turn the cornea here and make another wound. So this is then disposable after probably about 3 uses, and this is disposable after 1 use. This is phaco using the Kitaro set, and you can see here that we're making a paracentesis, injecting with viscoelastic, creating a wound, and performing the capsulorhexis. This is a resident who's done less than 10 cases. And so puncturing in the center, pulling a flap over, and now leading that edge around
And again, just carefully and slowly going in a tangential fashion, following the circle all the way around, and creating a curvilinear opening with a goal of approximately 5 to 6 millimeters. A little hydrodissection here. And then putting the phaco tip inside the eye. And I'm going to say that I think this is the most difficult part, actually, is that the sleeve, you can see, is getting caught and not entering the eye. So we decided to actually open the wound. It was a 2.4 wound, and just enlarge it slightly. And now we can get inside using some assistance from a second instrument. And now proceeding with phaco, creating or sculpting a groove here. You can see that cortical material that's flapping on top, but you can see that the nuclear material is inside. And now this is sped up in order to show. This is going to be, I think, a true divide and conquer. So creating the groove. And then using a second instrument to manipulate and turn the lens. And then to create the second groove. And then to get this to break into multiple quadrants. And then to remove those quadrants out. So again, this is now separating those quadrants. One of the problems with the fact that we've now enlarged this wound is that this allows a lot of air to actually get inside of the model here. And that inhibits our view. So we'll just have to gently proceed. And so you can see here that those pieces are being phacoemulsified and removed from the eye. And again, the visualization is not great because of the bubbles, but he's able to get all the pieces out. And you can see the white material is the cortical material, which also just comes out with the phaco. And there you have it.
One of the challenges of these kits is that there's so many parts and there's so many little items here that sometimes it's hard to know what you need for what step, and also what parts to be careful to make sure you don't throw away and what parts are disposable. So I'm just going to actually walk through the breakdown of the dry wet lab kit to orient you so you know a little bit about what to be careful about. So obviously, again, we have the face plate, we have the face, we have the orbits, we have these magnets. These are all permanent items that you have to keep, and you have to make sure you keep this the scleral shell. Otherwise, you will have nothing to put as the foundation for your eye. And then these instruments here, obviously, the mock instruments for practice are not disposable. You want to hang on to those. The syringes and needles and cannulas and cystotomes, these are items you should be able to easily get, in any operating room. So you could consider these disposable items, although these are, things we're going to keep on the kit. This is our fake viscoelastic and our capsulorhexis material. And then here, these are really, really important, and that is whatever goes inside here. Some of them are disposable and some of them are not. So the main things to remember are any of these cups you're going to put inside here, so you do not want to throw this away. And inside we have a more polymer, or they call it mock cortex inside here. You do not want to throw these away. You want to make sure you keep these. And the same goes for these items here, these orange things. You got to keep those. What goes inside, we talked about the polymer. These items also are for practice, and you do not want to throw them away. But most importantly are these items. So it's the corneal scleral portion. If you lose this, you're not going to be able to do anything. And inside this, you're also going to see, there's another portion here. This is for practicing wound construction and suturing. This white scleral part you want to make sure you don't lose. These are disposable. Okay. Now this is different from these items here. So these are the corneal scleral parts that you're going to use for actual phaco, and inside this bag, which has to be refrigerated, are the nuclei for phaco. This is for the wet part of the lab, and so it gets confusing because these items are actually disposable. You'll use them about 3 times in order to do your phaco, and then these are the nuclei. And this is disposable because you're going to make a capsulorhexis, you're going to phaco it, and then you're going to throw this item away. I mean, you can keep the orange shell, but these parts are disposable after you use them. These are quite expensive, actually, and so you want to make sure that you use them wisely. So I just wanted to give you that overview so you know what to make sure that you don't lose these little parts. This here, all these here. Lastly, I'm going to show you this set that's from Kitaro, which is called the Easy Eye. So rather than having the entire face, they have made this smaller so you can have just these components because it makes it easily portable. So this is anti-slip. So this is just the orbit. Again, it is the magnet and this cushioner to put on the sclera, and here you can see there's corneal scleral portion inside. There's the inside of the eye. So you could probably use this as the platform with all the other parts of the Kitaro kit, but this is just a little bit more portable, so you can again put those items on in order to practice capsulorhexis manipulation inside the eye. And so this is just another item called the Easy Eye set. So I hope you've enjoyed this wet and dry lab presentation. Cataract surgery is a lot of fun, and I hope you enjoy your journey to becoming an accomplished surgeon. Practice makes perfect. Best of luck.